Hey everyone, Dr. Jeff here with Live and Hope Chiropractic, and today we're going to be doing our Raising Healthy Kids Naturally workshop. So what we're going to do is just kind of cover some information as far as what can we do to help our kiddos deal with that sickness when it comes around, because we know that especially during school year, right, when you get exposed to other kiddos, they tend to pick up that sickness gunk a lot easier. So what can we do to try and prep our nervous systems and our bodies so that way when we are exposed to that, the immune system is thriving and functioning very well. And so that's kind of what I'm going to do is dive into some recommendations that we have, kind of go over our core four pillars, where we talk about these are the foundation for good optimal health, day-to-day life, all that good stuff. So here's kind of the core four that I was talking about, where nervous system, movement, sleep, and then living clean. Um, Number one, nervous system, that's the boss that controls so many vital functions of our body, almost actually like all of them. And what we see and talk about as far as that nervous system goes is the main avenue that we look at how can our body help regulate is the autonomic nervous system. That's the branch that helps us toggle between fight or flight and rest and digest systems automatically without us even thinking. The fancy terms are sympathetics versus parasympathetics. So sympathetics being that stress, gas, go, 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 good in short doses. Getting stuff done, getting jobs done, driving something pops in the road, you want that sympathetics kicking on, right? Then the opposite side is the parasympathetics. That's the rest and digest. That's where healing, growth, development really takes place. And so it's something where we want fuel in both systems. We don't want just gas dominant or brake dominant. We want enough reserves in both systems. So that way we can respond accordingly to whatever life throws at us. So that's kind of a brief overview of the nervous system functions. Then movement. Movement is life for all of us, right? Even, especially for little kiddos as we're growing and developing, we want them moving, we want them tummy time, we want all those nerves that are developing to get all that good input. Because, I like to think of it as the analogy of like water. What happens when water sits, right? It gets stagnant. It starts to get maybe some bacteria or algae. Just there's lots of um, disruption and change that happens in a negative light when water's just sitting there. Same thing that happens within our body, with our nervous system. If we are stagnant, if we aren't moving, we start to notice changes where our body just it really can go downhill. And, old expression, you don't use it, you lose it kind of deal. It really does apply to our body where if we aren't doing stuff, healthy movement patterns, we will feel those effects, so especially as we get older in life. There's research that shows anything, after age 30, muscle mass goes down about 1 to 2% per year if you aren't doing anything to prevent that. So it's like that's why it's so important for exercise, walking, weightlifting, all that stuff to really help our body keep moving. The next thing we talk about is sleep. Sleep is a big one for everyone. You can, really you can't get too much. I mean, sure, there are certain circumstances you probably can't get too much, but really across the board, on average, we all tend to get a lot less sleep than we should be getting. And then also what we talk about with that too is what does the quality look like as well? Because I'm sure you've been there before when you've had um, a good 8 hours of sleep versus a bad 8 hours of sleep. And what the main difference tends to be is that, well, if I'm having a good, I'm hitting deep REM cycles. I'm probably, not under any medication or anything to sedate me kind of deal. It's more of like I'm just naturally going to sleep, maybe take some supplements or stuff to help that, but overall pretty organic versus the disrupted. That can lead to not good deep restorative REM cycles. It can lead to just overall not feeling refreshed. Sometimes that's physically, right? If you're having aches and pains, that can disrupt sleep. If you're having muscle kind of cramps or just you feel like you just restlessness, that can happen. Or even mental restlessness, same thing can happen too, where it just feels like your sleep's getting disrupted. Um, and that's other stuff that we dive into as well. And we can talk about like what are some good sleep strategies, but usually some of the quickest ones are limiting caffeine intake. So generally speaking, limiting cut off caffeine by 11 to 12 a.m. Can help your body sleep if it's more of that mental restlessness. Foods cut off like 2 hours before bedtime. That can help. An hour before bedtime, limiting like blue light exposure. So it's like screens, put those away. So there's just, there's a lot of strategies that we can go into to help us sleep. But what one of our tools will do is we'll measure and see what is your sleep looking like and what's that. And then the last part, living clean. Uh, Kids and chemicals don't mix, right? I mean, even adults and chemicals don't really mix either. But it's something where we talk about trying to limit our toxins, and ways that we can do that. There's certain things that are within our control, right? But then other things, environmental, sometimes even plastics and stuff. Yes, we can try to avoid those, and that's great. But also, like, give yourself some grace, because sometimes people get so worked up trying to avoid every single toxin that they read about or hear about and all that stuff. And then it actually can be more detrimental to your body because you're getting so stressed mentally and you're just getting yourself firing on that sympathetic, that stress side all the time, that it actually can lead to heightened inflammatory response. Your body can just undergo a lot more immune dysfunction and all these things breaking down because your body's just on edge all the time. You just feel like you need to be responding instead of having a little bit more grace and ebb and flow with that. So that's kind of what we talk about as far as toxins go. Um, and so what I'm going to do is go over 7 steps to kind of help get us there. Steps 1 through 3 are eat, sleep, poop. Especially for kiddos, right? That's some of the most basic but vital functions that they need to do, because they aren't talking generally when they're babies and toddlers. And so they really should be doing these systems very well. And that's a lot of that vagus nerve stuff. So kind of on this guy here, we talk about, oh, sorry, I meant to try and highlight that. But vagus nerve, and we also have it kind of connected in our little fuse box. But this is the master control switch for our rest and digest system that helps us with sleep and poop. And so that's one that a lot of people have heard about. It's kind of picking up a lot of traction lately. It's like a buzzword. And it's because so many people are learning that when my vagus nerve is dysregulated or having dysfunction, all these other things can happen because it's not firing well. Things like heightened stress, dysautonomia, dysregulation. There's a lot of D words like dysfunction. There's lots of stuff that can happen in processes when our body isn't regulating well. And so we're learning that the vagus nerve, it has all these connections because it's one of the few nerves, cranial nerves that leaves the brain stem or brain, or right, sorry, the cranial vault and goes down into the body. And it has connections down to like our heart, our diaphragm, our gut, our stomach. And that's what helps it kind of pump the brakes. So it's a little kind of lengthy blurb about that vagus nerve, but it's just so vital for so many functions. But then also C1, C2, those are really big connections as far as nerves go in here. And so kind of what we talk about from a fuse box analogy is certain regions of our body control lots of different functions. The nerves are what wire and fire the body. So um, what we've tried to depict with our fuse box here is okay, C1 through C3, they control and have all these functions through here. They send signals to primary functions, secondary functions, then these are organs and glands and tissues that are being impacted as well. And then some of the kind of effects or side effects, if there's dysregulation or disconnect happening, nerves not sending that signal very well, what have you. This is where you can see all this symptomatology arise. Um, And really, that's why we talk about these because so many vital functions are being controlled by this little part of our nervous system. And that's because this vagus nerve. And so, what we aim to do with some of our process and scans too is assess that nervous system, assess these nerves, and see how are they firing? Are they communicating well? Are they not communicating well? Anywhere in between that. So that's kind of the vital functions as far as C1, C2 goes. Other regions of the body, we kind of try to break down the chopper upper region of T6. That's where lots of major digestion and detox and immune functions happen. Then the T12 region is like the sort of warehouse where that's a lot of our adrenal glands, kidneys, stress hormones, reproduction organs, all this stuff takes place down through there. And it's the kind of lower gut and digestion area. And then S2, the poop button. That's kind of the poop switch that lots of parents have probably heard about. You may have heard about it too, where when they're little babies and they're constipated, not pooping well, they're like, hey, can you go push that poop switch or poop button? S2 is the notorious region for that. It's not always that simple as like, hey, we go push and adjust S2, and then it just makes blowout happen immediately. But it is a vital part where there's a lot of neurology here with that parasympathetic plexus down below. So again, that's the brake pedal down low that helps regulate our body through there. And oftentimes when we address the sacral areas, it can really help also engage that rest and digest system. And that's where you can kind of have more poop and sleep happen. So those are some kind of neurology and kind of our lingo as far as what we're looking at. So, when we talk about, hey, we're looking at C1 or C2, this kind of breaks down and gives you an idea of, okay, if he's addressing or adjusting here, what is he even talking about? And that's what our fuse box does. Step four, movement matters most. So motion, we want a body motion stays in motion, right? And so the way that we develop, brains are built bottom up, back forward over time. And so really we try to encourage motion, 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 because that's what helps the brain develop. It's what helps give it signals saying, hey, here's connections. Um, so that's the big one through here. And we kind of dive into this a little bit more. This is maybe a little bit of a hot topic where in 2022, the CDC kind of removed developmental milestone of crawling. It's no longer there. Then they pushed back walking to 18 months and talking pushed back 3 to 6 months. So it's just something where it's like they pretty much move the goalpost further back. And that's just feel free if we want to get in discussion about that. I'd be more than happy and willing to have that conversation. It's just something where it's kind of odd in the sense of how crawling is being removed because it produces so many vital brain function developmental pieces that crawling creates cross communication between right and left hemispheres. It's just so good for setting the future pace for developing babies that we want to see babies crawling because that's what helps with so much coordination and functions. Um, and even there are times when kiddos might skip that crawling milestone and go right into walking. And I know some of the parents are like, yay, my kid is doing this first. Not trying to poke the bear, but usually it's because they're so tense and stressed that their body is very rigid. So they almost look like little Frankenstein babies when they're walking. And that's not inherently a good thing. It's more of a sometimes we need to slow down and go back a step or two and get back to crawling. So there are times when we check out patients and if they're crawl or if they're walking before crawling, we almost try to be like, let's kind of pump the brakes on the walking. And I know it's exciting and you wanted to see them eventually doing that. But if you kind of go back to that crawling motor milestones, so much cognitive function takes place there that it's really hard to just skip that. And so that's again, I'm open for a conversation if you want to ask more and dive into it more. But yeah. Number five, be prepared to kick the sick, without meds. And we talk about that because The body, when we get exposed to sickness, it really, yes, we want to see it respond certain ways. Sometimes it can be overwhelmed, it can be immune compromised. Yeah, absolutely, there are extenuating circumstances where meds might be a little bit more necessary. But in general, like we try to be like, let's not be so quick to take the fever reducer or the cough suppressant because there's some good research articles here that we have shared, and even Josh Axe's book, Eat Dirty, he has a really good talk about leaky gut, and how what that can lead to is um, summarizing it in the best way possibly, it would be more of like think of it as when we have leaky gut, our body isn't able it's to absorb as well. It's almost malnourished. So even when we're getting all the good nutrients and foods and supplements, it's almost like we're just kind of flushing that right out of our system and down the toilet because our body isn't doing the digestion processes as effective as it could. And it's just kind of trying to flush out. Um, and that can be problematic when we're trying to take supplements too. Like if we know that we're deficient in stuff, finding the right level to get can be tricky because like, well, I don't know how much I'm actually absorbing. And yes, there are panels and labs that can help, and we certainly encourage that. But it's just something where not always is it necessary to just try and kick that gunk with meds it right away. So, because even with fevers, your immune system's trying to fight off an infectious disease. It's trying to combat that and cure up. And when we take a med to suppress that, it almost is trying to tell your body, like, no, these bacteria and virus stuff in my body, it's fine. They're okay. We'll let them pass through the gates. No worries. And that can be really problematic because then you can just be letting your body um, just essentially suffer more because you're trying to mask symptoms instead of take care of root causes. So that's step five. Um, and this is kind of what I talked about. This is a little bit more nerding out with like Th1 receptors. That's our parasympathetics. That's the rest and digest, the pads or brake pedals. That's expressive immune function. And then Th2 is our sympathetic. They suppress immune function. And so that's kind of the big role of not only like our thyroid functions, but also that vagus nerve and the gut immune connection too. And so there's just lots of connections that we talk about where when there's interference, think of it as brain-body disconnect. And so what chiropractic does is reestablish that brain-body connection via the adjustments. And that's kind of the way that we best can describe it is it doesn't have to be the big crunches or pops to adjust the body. I know there's lots of videos out there showing like big movements and stuff, especially the littles. Less is more. It's really trying to address those nerves and that connection more than just having a big audible osseous cavitation or pop. And that's kind of what the scan process that we do is enables us to find out maybe a little bit more root problems and causes and then address the body and adjust the body how it needs versus how we think we need it. So, especially if there's kiddos that are having lots of recurrent sickness and cough, congestion, we tend to see those middle thoracics have a lot going on. Usually, we do bigger movements in those areas to help get that gunk flushed out. Other times, if there's lots of tension, sometimes it's like loosening a pickle jar, where we go nice and light with the connection because we want to help calm stuff down. And so that's kind of the nerdy cool part about the adjustments is there's lots of levers and toggles that we can do to help stimulate certain nerve branches or kind of calm down other branches, systems and functions. So it's really kind of cool. But that's what some of the scans will do is help give us the best idea of that. And that's kind of what this slide goes into a little bit as well. So, we talk about plumbing and drainage movement. Yes. Step four, step five, these are great. This is something where it's like that nervous system has gas versus brake pedal systems, like we were talking about many times. But I think of that as adrenaline, stress, cortisol, fight or flight, good in short doses to get stuff done or again avoid that danger. Then brake pedal is rest and digest, healing, growth, development, immune function takes place. But we want reserves in both of these. So just like driving a car, we want good gas and good brake. We don't want to have too much from one tank and not enough in the other reserve, because then we're going to just be dominant in one system, and neither is good. We want to be fluctuating, toggling between the two systems as the need arises. So this is nature's medicine cabinet. We talked about step six, where these are the four pillars that we discussed. But then, yeah, healthy nervous system, sleeping, exercise, clean foods. These are some good immune system boosters for when you're under the weather. Everyday boosters are kind of what we encourage, just day-to-day life, like taking care of your body when, you know, even when there's not a sickness or immune system challenge coming up. But then here we have a little bit of a breakdown of a little bit more specific issues that might be popping up. What are some options that we can try and do? Um, and so this is something that we can send home with you as well, or we can send this to an email and just be like, hey, here's a good little cheat sheet of some good supplements and stuff to try and do. So, yeah. And then sequence and order matters most. So if we don't have those top foundational pillars intact, that's where you can see disruption happen. You know, it's kind of like the analogy of like building your house on sand, where we don't have that firm foundation. It's not solid ground. It's a little bit more shaky and unsturdy. That's what can happen if you don't have these four pillars in order, and that's where you can sometimes see that recurring sickness and gunk happening because you don't have the core foundation stable and your body, you're trying to build it on that. It's not going to end very well as far as this sickness battle goes. You just feel like you're on in a revolving door of sicknesses. Um, so yeah, um, this is a story we share as far as um, Axton. He was dealing with lots of recurring ear infections, antibiotic schedules, and they're scheduling him for surgery. That's what can happen a lot, and we see that so commonly is that if we have chronic ear infections, we go take antibiotics. And what that does is it depletes all of our gut flora. And that's where 70% of our immune function happens with it is within our gut. And so if we deplete all the good and the bad bacteria, and then what can happen is our body is more prone and more susceptible to other infections because the immune system is compromised, it's being suppressed. And so that's why you can see like, oh my goodness, I just feel like I'm cycle after cycle of this treatments. And that's where like the post antibiotic treatment care comes into play. Because yes, there might be a time and a place where antibiotics are absolutely necessary, and we get that. It's just something where sometimes if we're just rushing to do antibiotics first and foremost as a first line of defense instead of the last line, it can lead to just that more, again, that revolving door, just churning up infection after infection. And that's where even if we do get on antibiotics, like what are we doing after? Are we doing our prebiotics and probiotics? Or are we doing stuff to try and help replenish that gut flora? Or are we just waiting for that next infection to come around? So this is a cool story about Axton and how he went from needing tubes to thriving. And so action steps, you know, continue asking questions, following the right people, find your tribe that's going to help with your needs, and not be afraid to speak truth and love, right? And be like, hey, this is what's going on. Consistency is key. You know, you're not gonna do stuff perfectly, and that's even what I talked about with the toxins is give yourself grace. Like we're not gonna be all live that completely detox and toxin-free lifestyle, but what can we do to try and help manage and limit them as best we can? And then get scanned here at Live and Help Chiropractic to assess that nervous system's function. We would love to see you and go into how maybe chiropractic care can help address your nervous system's dysfunction and needs, because there's lots of cool healing and potential that can be addressed when we have that nervous system well regulated. But yeah, talk to you soon, and forward to answering any questions or comments you may have. I'm open for it, and yeah,